Greetings, Dr. Victor here. Today we'll find out what is prediabetes, do you have it, and when to test for prediabetes. So watch until the end of the video to find out. So what even is prediabetes? Well, it's a condition preceding diabetes, meaning high blood glucose, so high blood sugar. It's important to know that 88 million adults in USA have prediabetes, so that's basically 1/3 of the adult population. And another big proportion don't even know that they have prediabetes, so they're undiagnosed. So yeah, we know that prediabetes precedes diabetes, but why does it happen? Well, an unhealthy lifestyle, so being sedentary, not doing physical exercise, eating processed food, high in processed carbs, not that much natural, healthy food, leads to a rise in blood sugar, so blood glucose. The body can manage for a time these high levels of blood glucose. Your poor pancreas secretes excess insulin to clear out all that blood glucose. It gets all that glucose into fat, into your liver stores, and for a time your blood glucose is okay. But from this point, even though your blood glucose is okay, so it's normal, your insulin level is high. So your poor pancreas is compensating that high glucose level with increasing the insulin secretion. So basically the first stage is usually normal glucose levels but increased insulin levels. In time, the pancreas can't handle all that blood glucose in the body for long periods, years, and after a while your body becomes resistant to insulin, so insulin resistance, and even though it has a ton of insulin in its blood, it still can't handle all that excess glucose, and starting from this point the blood glucose will start to rise. So here you have pre-diabetes. But usually the first step is accumulation of fat, liver stores, your insulin levels start to rise, and then after a while, at first your blood glucose is normal, and only then when the insulin resistance has come up and the insulin and your poor pancreas just can't handle all that glucose in its body, only then the blood glucose starts to rise. So you can still be on the road to diabetes and your blood glucose be in check, but if you continue on this path, the blood glucose will rise and soon you will have diabetes. Unfortunately, most people with prediabetes are asymptomatic, so they don't even have any symptoms. But there are certain risk factors that we're going to talk about that increase the chance of prediabetes and diabetes. Now, prediabetes can be basically tested in 3 ways. So you can either do a fasting plasma glucose, so after an overnight fast, you're going to check in the morning your blood glucose. And if it's between 100 milligrams per deciliter and 125 milligrams per deciliter, then it means it's prediabetes. If it's under 100, it means it's normal, and if it's over 125, it means it's diabetes. The second test is the overload test with 70 grams of glucose. So you're gonna drink 70 grams of glucose, which tastes horrible, but what can you do? And it's prediabetes if after 2 hours it's between 140 and 199 milligrams per deciliter. And number 3 is the glycated hemoglobin, also called A1C, which basically is an average of your blood glucose in the last 3 months. And prediabetes means it's between 5.7 and 6.4. Now the sad part about prediabetes and type 2 diabetes is that it's a preventable disease. So if someone were to modify sufficiently their lifestyle factors, their diet, their exercise, their risk factors, it's a completely 100% preventable disease. So that's why it's so important to learn about this disease. But now let's see who is at risk. By the way, all this information is from the latest guidelines from the American Diabetes Association and can be found there. Now, as a general rule, if you're over 45 years and you're asymptomatic, so nothing's bothering you, don't have any symptoms, you should do one of those 3 tests for checking pre-diabetes. And if you find everything's normal, then you should check your blood glucose every 3 years. But if you find you're a pre-diabetic, then you should check every 1 year. Who should get tested? Who is at risk? Well, every adult, even if he's asymptomatic, so he doesn't have any symptoms, if he's overweight or obese, so over 25 BMI, and if you are an Asian American, even earlier than that, because they can have normal weight and still have an increased risk. So an adult that is overweight and has at least one of the following risk factors. A first-degree relative with diabetes, because it increases your chance of type 2 diabetes. A high-risk ethnicity such as African American, Latino, Native American, Asian American, and Pacific Islander. A history of cardiovascular disease, hypertension, so over 140 with 90 millimeters, low HDL cholesterol levels, so the good cholesterol under 35 milligrams per deciliter, or high triglyceride levels, over 250. Also women with polycystic ovary syndrome, because this is linked with insulin resistance, physical inactivity, so if you're sedentary, other conditions such as acanthosis nigricans, meaning this darkened skin tone, frequent regions affected being the armpits and the neck area. and also some other regions where the skin folds. Also, another risk factor is if you have severe obesity, so a BMI of over 40. Also, be careful if you have a lot of fat in the abdominal region, being associated with a high level of visceral fat. Women of whatever age who have been diagnosed with gestational diabetes need to be tested every 3 years. Also, patients with HIV should talk to their doctor to be checked for diabetes or prediabetes. And if you have none of these risk factors, then you're just gonna start testing at the age of 45 every 3 years. Also, children that are at the age of 10 or have reached puberty should be checked if they are overweight or obese, and they have at least one risk factor of the following: family history of type 2 diabetes in first or second degree relative, a maternal history of diabetes or gestational diabetes during the child's gestation, again certain races that are at a higher risk, such as Native American, African American, Latino, Asian American, and Pacific Islander, and other signs of insulin resistance, such as again acanthosis nigricans, hypertension, dyslipidemia, polycystic ovary syndrome, or small for gestational age birth weight. So now you know if you are at risk of prediabetes and if you should get checked. And also, it's a simple test that you can do to find out your diabetes risk, and it's called just that, diabetes risk test from ADA. And basically, let's do it now. We go on here, risk test from ADA. No, and for myself, put in your age. Are you a man, are you a woman? Do you have a mother, father, sister, so first degree relative with type 2 diabetes? No, I don't have. Have you ever been diagnosed with high blood pressure? No. Are you physically active? Yes, but let's put no in this case. What race, ethnicity? I'm white. My height? Okay, I think it's also in centimeters, good. Yep. Send my results. Okay, or view your results online, good. I have a low risk score, but you can do this test and see your actual risk score. So it's an easy way, like a preliminary test to find out. But if you are to score at least 5 out of 10, then you're at risk for prediabetes and you should go and get checked. For example, let's do it again, but the version of me that's slightly unhealthy. So I'm a man again. Do I have? Yes, I have relatives. Do I have high blood pressure? Yep. Am I physically active? No. Let's say I'm Asian, which is an increased risk, unfortunately. Again, and also I'm overweight. Your results, oh look, I'm a 6. So your risk of having is high. Okay. So this is a good score that you can do online, and it's pretty easy to do. So I hope you found that useful. Write in the comments if you would like to know even more related to prediabetes or diabetes. What are the risks? How can you prevent this? Is it possible to have remission of prediabetes or diabetes? Please leave it in the comments. Because with your feedback, I'm gonna do more videos about what would you like to know more of. So thanks for watching. Hope you found the video useful. Please like, subscribe if you did. It helps growing the channel, the notification bell, and we'll see each other next time. Salut!